Next question. After birth, which of the following happens in the newborn? So the foramen ovale sits between the right atrium and the left atrium, which the first answer option talks about. After birth, that gap or that hole actually closes over. So the first answer option is not it. Hemoglobin A is replaced by hemoglobin F. So it's talking about the adult version of the hemoglobin and the fetal version of the hemoglobin. But the second part of the answer option, which says that may lead to physiological jaundice, isn't really the result of that replacement. The jaundice actually comes from the newborn's liver unable to metabolize the bilirubin that's actually formed, which is not what the hemoglobin is kind of really talking about. Could it be? The umbilical veins in the registration rate open for several days. The ductus arteriosus. So I'm going to pick ductus arteriosus closes. That is between the pulmonary artery or pulmonary trunk to the aorta. So I'm going to click it and we are right. Next question. 59-year-old man presents to urgent care center requesting an emergency prescription. He's on holiday visiting his daughter, has forgotten his regular medication. He started to feel unwell and worries it is because he's missed several doses. His OBS are heart rates elevated, so it should be between 60 and 100. Blood pressure is normal. Wrist rate is normal, so that should be between 12 and 20 breaths per minute. Temperature is normal. Oxygen saturation is normal. Abrupt cessation of what drug can cause the abnormality shown in his vital signs. So the abnormality here was the heart rate, which was elevated. So we're kind of thinking about something that increases the heart rate, something that affects how fast the heart beats per minute. We're thinking about your antiarrhythmic drugs, which are your 4 classes: class 1, class 2, class 3, class 4. Class 1 and class 3 are your sodium and potassium channel blockers, and then you have your class 4 and class 2 and class 4, which are your beta blockers and your calcium channel blockers. So we need to find the one that is either one of these. Amlodipine is a calcium channel blocker, can lower it. Bisoprolol is also a beta blocker because it ends in olol. That can also, if you stop that can also increase your heart rate. Furosemide, I haven't heard of that. Ramipril is a ACE inhibitor, which is for controlling your blood pressure, and I haven't heard of the last one. So to be on the safest side, I'm going to pick a beta blocker, and we will see. And that should be right. But I just wanted to know why amlodipine is wrong. I know that it's used to treat hypertension and it reduces blood pressure. It says that making rebound tachycardia unlikely when suddenly withdrawn. That might be specific to either amlodipine itself or calcium channel blockers, which we weren't really taught. Next question. A 2-week female is referred to the pediatrician due to poor feeding and poor weight gain. On cardiac auscultation, continuous machine-like murmur is heard. In echo reveals a ductus arteriosus, patent ductus arteriosus. Okay, so what that means is that, as I said before, the ductus arteriosus is between the pulmonary trunk and the pulmonary arteries and the aorta, and it links both of those together when the fetus is in the womb, and it causes a shunt between the pulmonary side of the circulation to the aortic side because the lungs aren't fully developed. They're kind of filled with fluids. You don't want blood going in there. So it actually pushes the whatever blood that actually gets through to the pulmonary arteries, which is minimal anyway, into the aorta. When the baby's born, that kind of closes off by filling up with connective tissue. And so you don't get that flow through. If it's open, because the left side, the aorta side, has a higher pressure than the pulmonary side, it's actually going to push the blood back from the aorta into the pulmonary arteries. It's going to mix up that oxygen and deoxygenated blood. That's the physiology behind it. So this is more of a recall question. It's asking whether if the structure is closed at birth, what would the remnant be called? So if it's called ductus arteriosus, and I said that it fills up with connective tissue, it's going to be called ligamentum arteriosum. Cool. We'll do this one more and we'll wrap it up for cardio. 56-year-old woman is diagnosed with angina. She started on some medications, both for symptom control and secondary prevention. The doctor also wants her to work on changing her diet whilst explaining this to the patient. The doctor prescribes why excess fat in the blood can lead to angina. Under normal circumstances, which apolipoprotein do macrophages recognize in order to uptake lipids? Now this is more of like sort of biochemistry kind of thing. For you to understand this topic, you kind of need to know about the different kinds of receptors that the cells in the body can produce in order to recognize these different kinds of fat molecules that are circulating in the blood. Now, since they're talking about medications and diet and all of that and excess fat, I'm thinking about LDLs, or what are known as colloquially the bad fats, right? So these bad fats have specific receptors that can recognize them and uptake them. And so it's talking about what these receptors are. Now, from memory, I think that it is either ApoC2 or ApoB100. So I'm gonna say that from memory, it's been a while since I did this because we were taught this in first year, but I'm gonna say it's ApoB100 because I think ApoC2 is actually on the endothelial walls. Okay, so let's have a look. There you go. So it is ApoB100. We can have a look to see if I got the other one correct. So that's what happens if you have too much LDLs in the blood. So you can get occlusion of arteries and causing all sorts of other conditions, most commonly known as atherosclerosis, but it can cause like heart attacks and other things. But they haven't explained the other ones, so that's okay. I'm pretty sure ApoC2 is in endothelial walls. Cool. So I hope you found that a bit fun, a bit exhilarating. Let me know if you liked it. I might do more videos like this. It's been quite fun for me as well. If you enjoyed it, yeah. I will see you guys in the next one. I don't know when I'm going to put this out. I've been quite busy, but I will see you guys soon.